Good evening, everyone, and thank you for joining us this afternoon for the Florida Senate District 32 Tuesday Talks. Our focus this afternoon will be the importance of eye health. And at this time, I'm going to turn it over to Ms. Ruby Garcia, and she will introduce our panel for tonight. Ruby.
Good evening, everybody. Thank you for joining. And first up, I'd like to thank the panelists for being here. I'd like to kick it off with Dr. Sherrol A. Richards. She's a graduate of University of Florida and now Nova Southeastern University College of Optometry. She is a professor of optometry at Nova and serves as chief of the Davie Primary Care Clinic and director of the Retina Clinic. She's a fellow in the American Academy of Optometry and the Optometric Retina Society. She served as president of the National Optometric Association from 2017 to 2021 and currently serves as past president. She was awarded the National Optometric Association Optometrist of the Year in 2013. Thank you so much for being here, and we look forward to all your input this evening. Next up is Dr. Olivares. She was born and raised in South Florida. She earned her degree in optometry at Nova Southeastern University while on the Chancellor Scholarship and graduated in the top 10% of her class. Her undergraduate schooling was completed at the University of Central Florida, where she received a bachelor's degree in molecular biology and microbiology. Dr. Olivares completed externship training at the Bascom Palmer Eye Institute in diagnosis, management, and treatment of ocular disease with an emphasis on glaucoma and retinal disorders. She has received several honors, including the Beaver Visitech Dry Eye Award. She also held leadership positions in the Beta Sigma Kappa Honor Society and Gold Key International Honor Society. Dr. Olivares is an associate to a private practice in Pembroke Pines, Florida, and she also speaks fluent Spanish and is committed to the South Florida community. Next up is Dr. Blanc Smith. He obtained a Bachelor of Science in Biology and a minor in Business at the University of South Florida in 2005. He pursued a degree at Nova Southeastern University in the College of Optometry. He has received several accolades there, including Beta Sigma Kappa fraternity, making the Dean's List every semester, graduating with honors, and he was inducted into the Golden Keys Society, graduated in the top 20% of his class. Dr. Blanc is very active in his community. He participates in numerous health fairs, screenings, and medical mission trips abroad. Dr. Blanc also served as the president of the Broward County Optometric Association from 2020 to 2022. He also completed a residency specializing in cornea and contact lenses at Nova Southeastern University in 2010. Thank you so much for our panelists for being here, and welcome.
Thank you for having us.
Thank you.
Thank you. So we're going to jump right in with this important topic that we don't talk about enough. Most of the time, we do not visit an eye doctor unless there's a problem or an issue. And I'm going to turn the panel over to Ruby, Nija, and Julie, and they will facilitate our questions as we start tonight and direct the question to one of the doctors, or if all of you want to respond. I am just so appreciative of you joining us tonight. And we connected recently through Miss Joseph, and I told you that that wouldn't be the last time that we connected. So I'm ecstatic to begin having these discussions tonight. So we'll start with you, Julie.
Great. I'm going to ask each of you the importance of nutrition.
So Julie, you're having a connection issue. Julie's having a connection issue. As you guys know, we're in Florida and we have a storm and a hurricane approaching us. So I'll go to Ruby and then to Nija, and Julie can work through her connection issue. We couldn't really hear what she was saying. Go ahead, Ruby.
Okay, I'll leave that question up to Julie, but I guess I can kick it off. One of the things that preparing for today, looking at some of the issues that people face, I know there's a big spectrum about, we could discuss about eye health, and I'm sure you guys have some topics that you want to discuss. But being I was a work at home mom for so many years. I'm a mom, and all, as women, we have so many beauty products. We're also, a lot of us, in charge of a lot of the cleaning. Well, we share the duties, right? But what are some of the products, like daily products, that maybe we're using that may be affecting our eye health that you wish people were more aware of? And I'll open it up to Dr. Olivares. You're the first little head on my screen, so.
Perfect. So a lot of these makeups that we're using can actually cause issues with the ocular surface, which is the front part of the eye. So I have a lot of patients who complain of dryness and irritation on the surface of the eye, and they come in wearing loads and loads of makeup. So it's really important that if you are going to wear makeup, that you make sure that you clean it off every night before you go to bed, that you're disposing your makeup like you're supposed to. They say mascara should really only last about a month. And I know some of us maybe only wear mascara on the weekends, and then it kind of adds up and you're like, oh my gosh, I've had this mascara for about 6 months now. And I think it's really important too to stay with products that are as clean as possible. We always say that for our patients who have very sensitive, dry eyes, that the best makeups are Almay and Clinique. So those are the ones that tend to cause less irritation on the surface.
I want to add to that also too, with all the makeup that women are wearing, moms are wearing, these eyelashes, just to comment on those, these do-it-yourself eyelashes that are also women put on. Those products can also be damaging to the eyes. Not only can they cause you to lose your natural eyelashes, but the glue can be an irritant to the cornea or to the front surface of the eyes as well. So I always want to caution patients that are wearing not just heavy makeup, and as Dr. Olivares said, you want to be conscientious in making sure that you change your makeup, fresh makeup, or hypoallergenic makeup, and clean your eyes properly every night that you take it off, but also to these products that you're using in and around the eyes, liquid eye makeup, or the glues that you're using to do eyelashes. And other things, you talked about the home is so important that any time there's any sort of irritants that get in the eye, anything you're cleaning the home and irritants get in the eye, that you see an eye doctor as soon as possible, because that can also irritate the front surface of the eyes. If your children throw something at you and it gets into the eye or it hits your eye as they're working as a stay-at-home mom, you should get an eye evaluation. Sometimes the simplest thing, being hit by your toddler with a little train set, can cause a retinal detachment or changes in the back of the eye. So those are some of the things I just want to mention as well.
Oh, thank you. That's good to know. And it's so many products available. It's interesting to know that very few are actually recommended by optometrists. Naija, do you want to ask a question or?
Yes, just actually following up from your question with the makeup. I know I work in an office and I now have to use like blue light glasses just to look at the screen. Side note, are those helpful? And with the increased use of screens that that everyone uses every day, what are your concerns about the effects on children, adults, and seniors that uses computers every day? What can we do to prevent, eye damage, eye wear and tear, things like that throughout the day? And, just what can we do? And I can open it up to anyone.
I can start this one off. As far as the blue light, this is Dr. Blanc again. As far as the blue light filters and the blue light with the computers, the biggest problem with the blue light emissions coming from the computer is they are known to interact with the circadian rhythm and disrupt your sleep pattern. So if you tend to look at your phone and watch YouTube or any other platforms right before you sleep, it can mess up your sleep pattern. And in addition, not only does it mess up your sleep pattern, the more you are on the device, the more you are changing your natural posture, and it can give you what we call computer vision syndrome, and it can cause all sorts of headaches and eye fatigue.
Additionally, again, Dr. Reynolds, Sherrol Reynolds, I just want to add that there's been a lot in the literature about blue light when it comes to eye health. So we know that those short wavelengths of light, such as blue light, that are emitted from your iPhone, your iPad, and your computers can also cause ocular health, retinal health. So the back of the eye, the retina, so that can cause damage to the back of the eye. So you have patients that have blue filters, not just because they're on the screen, but also to protect the overall health of the eyes. And I do want to caution when we talk about children, we're seeing a lot more children on computers, number one, because during COVID, they were staying at home, Zooming. And so what we're seeing now is a lot of children develop nearsightedness that is called myopia. And sometimes with the degree of nearsightedness, it can lead to changes in the back of the eye. So right now there's a big push in eye health to kind of control nearsightedness. It's called myopia control. So it's good to have your children, especially young children, take frequent breaks if they're on their iPad computers. And I would also caution parents, young kids, to not use iPad or iPhone as much, because sometimes we see children on them as early as, I would say, 3 months, 6 months, they're on their parents' phone interacting. So just taking more frequent break, the 20-20-20 rule, 20 seconds of break from the computer screen is really good.
And I have a lot of patients ever since COVID where patients are now using the computer 13 plus hours a day, complain a lot of headaches, eye strain, neck pain, and that can have a lot to do with their eye posture. Whenever we go to see the computer for long hours, our eyes must come in, they must converge. A lot of us, our eye posture is slightly outwards. So that constant movement of having to keep our eyes straight where we're looking so that we can keep a single clear image can cause issues, visual disruptions, headaches. So those require certain glasses to correct for your vision called the NeuroLens glasses. So computers can cause a lot of different issues with your vision. It can cause just general eye fatigue if your accommodative system or your focusing muscles don't work properly. I also see a lot of kids at my practice, and like Dr. Reynolds had stated, 1 in 4 children actually have vision disorders that may go undiagnosed. A lot of times our children cannot let us know that they're not seeing clearly or that they're having headaches or eye strain or issues with their vision. They don't know what normal is to them. So they actually say that your first eye exam should be at 6 months of age, and then at 3 years, and then at 5 years if the child's vision is normal. We are seeing a huge shift towards nearsightedness or myopia, which is the inability to see out at a distance because of this shift towards electronic use. They say that try not to let your children use the computer or iPad for more than an hour or 2 a day. If we're stuck in a nearsighted environment, this is going to force our eyes to become more nearsighted, which in turn can lead to different vision threatening disorders such as retinal detachments, cataracts, glaucoma, maculopathy. And these are all different diseases that we as optometrists see daily in our patients, which is very sad. So the best thing is to get all children checked, know the difference between a vision screening versus a vision exam. Vision screening is just done at the pediatrician office, at the, your school. And that's just someone checking with an eye chart. That doesn't really check all different diseases or problems that children may encounter. So it does not replace the need for a full eye exam. So just because your child passes that vision screening at your pediatrician office doesn't really mean much. So it's super important to get these children diagnosed early so that we can treat them early so that they can continue to do well in school and that it doesn't disrupt their visual system and cognitive function as well.
Thank you.
Actually,
Thank you, everyone.
I want to piggyback off that because I know I have young ones. Part of their, they got to do their annual physical and all that. And they've done like the vision test that you mentioned. So what is a parent to do in order to get a real vision screening? Is that something they ask the pediatrician for, or do they kind of set that up with an optometrist? What is the protocol for that? Or what would you suggest parents do? Yeah.
So I would just take the vision screening with a grain of salt. Doesn't mean much if you pass, and it doesn't mean a whole lot if you fail either. I think it's just something that pediatricians like to do to pick up like big problems with the vision. But I always suggest that every child needs a full vision exam with dilation, with an optometrist, to actually fully see if that patient or that child is going to have any issues with their vision. A lot of pediatricians don't know that the first eye exam should be at 6 months as recommended by the AOA. You know, a lot of times they do that vision screening and they give that parent false hope that the patient's vision, that their child's vision is fine, that it's normal. And then sometimes they come and see us and they're, you know, confused. Well, they passed the vision screening. Why does my child need glasses? You know, so it's not a full eye exam. It doesn't really tell you much, to be honest.
So I'm a proponent of vision screening. I think vision screening is very critical. I think your pediatrician checking your children's vision is essential. However, as Dr. Olivares said, and one of the things I always say, you can have 20/20 vision and still have eye problems. And it's not just for our children, it's also for our adults. You can have eye diseases such as glaucoma, macular degeneration, you can have diabetic retinopathy, and we'll talk about those diseases as we go through this presentation, and have perfectly good vision. So for our children, what we're noticing, as she said, and we noticed this before, but kids are doing a lot more up close work. They're doing more homework, and lately they're on computers more, especially during the time of COVID. So it's important to get all children a comprehensive dilated eye exam in addition to the screening. So the screening is great. Again, they can have 20/20 vision, but have a focusing issue where the eye muscles don't work. It doesn't mean that their vision isn't good. It just means that they have a focusing issue. And so glasses can help them focus better so that they can perform in school better. So again, the recommendation is to get a comprehensive dilated eye exam, but screening is really a great way to catch children, because we know, especially in underserved communities, minority communities, that screening sometimes is the first indicator for a lot of children that have eye issues. So I'm a proponent of screening as well as a comprehensive dilated eye exam.
Going back to what Dr. Reynolds had mentioned real quick, as far as being 20/20 and still having eye issues or eye diseases, I actually had a patient who had perfect vision about 2 years ago, and she came for an eye exam because she was losing her reading vision, and she ended up having an ocular melanoma in her eye. And that's cancer in the eye. And this is a patient with 20/20 vision, better vision than myself and better vision than probably a lot of us watching this. So a lot of times people think I only need an eye exam if I'm not seeing properly. But in reality, everyone needs an annual comprehensive dilated eye exam in order to check for eye health. It's not just to check for eye vision, it's to check for the health of the eye.
Thank you. And I think I know what Julie was gonna ask, so I'm gonna just jump in. And I'll throw this one to you, Dr. Blanc. How important is nutrition in eye health? Is that something that we can actually improve? Do supplements work? How important is that? Or is it just genetics?
Yes, thank you. Nutrition is very important in eye health. Nutrition has the ability to affect and improve dryness. It has the ability to improve in your macular pigment. So when Dr. Reynolds mentioned age-related macular degeneration, this is a condition where usually it's older individuals, 65 and older, usually have a little bit of a problem with their macula, which is the center part of your vision. So if you're looking at me right now, Ruby, the portion that you're using the most is your macula, right? And sometimes the normal retina has the ability to clear that. And macular degeneration, that portion, the nutrition hack with it. They even have eye vitamins specifically for that portion. And so nutrition is very important. Am I freezing? I feel like I'm freezing.
Yes, you did freeze
You
up.
did a tiny bit.
Okay, hold on one second. Let me switch my internet.
I just want to add to what Dr. Blanc said. So a lot of studies have looked at nutrition and eye health, and I'm a proponent of what you eat is who you are, right? So if you eat healthy, your eyes are healthy, your overall body's healthy. If you don't eat healthy, you have eye problems, you have body problems, right? We know that unhealthy eating can lead to other diseases such as diabetes, high blood pressure, high cholesterol, which can manifest in the eye. But various studies, so you see a lot of commercial about eye-friendly vitamins, especially when it comes to a disease like macular degeneration, is based on various evidence-based medicine, multiple studies that looked at eating healthy can reduce damage to the cells in the back of the eye and preserve the health of the overall cells in the back of the eyes. So we do recommend patients that have certain disease like macular degeneration take certain, combination of eye-friendly vitamins for the eyes. But I also talk to my patients about, certain supplements such as omega-3s might help with dry eyes. We know that lutein and zeaxanthin, which are some eye-friendly vitamins, can help with the damage that's caused by the short wavelengths of light. So I always advocate that if you eat healthy, those healthy foods, your spinach, your kales, your colored peppers, they're a good source of nutrition that can support not just eye health, but overall health for the patients. And it's important to start that early for kids too. We're seeing a lot of kids on devices. Blue light, as I mentioned earlier, can damage not just the back of the eye. So it's important that we make sure that our children start as early as possible to eat healthy foods that are healthy for the body, but also healthy for the eyes.
And I think that we need to be careful with the vitamins that we are, seeing on the internet. A lot of these vitamins don't really work and aren't studied as well as the ones that Dr. Reynolds was speaking about. So, if you see some over-the-counter pills or some pills on the internet that say that they can cure cataracts, it's probably not true. So you also have to make sure that when you go see your optometrist that you ask them for their advice as far as what supplements to take, because there are some that don't actually do much for eye health or don't say that they do what's written on the bottle.
Thank you. So all those pills, I have to get rid of them. Thank you.
Yeah, I wanted to jump in and just ask a quick question. I wanted to direct it to all of our panelists. I hear you guys mentioned a lot of different eye diseases, like even melanoma, eye cancer. Are there any common indicators that would indicate that we would have these issues? If there are any, like will we have pain, headaches, just to know what to look for and what would make someone want to come in?
I just want to jump in on that one. And remember what I said, you can have 20/20 vision, perfect vision and have eye problems. But I do want to just talk about some of those systemic conditions that I see mostly in the retina clinic. Patients with diabetes, we know that diabetes is increasing in prevalence. Half of the United States population have diabetes, are at risk of diabetes. In fact, diabetes, how it affects the eyes, is one of the leading cause of vision loss in working age adults, those 20 to 74. So it's important if you have any family members, if you have diabetes, that you get a comprehensive dilated eye exam every year. Glaucoma, a disease that disproportionately impacts minority communities, can rob you of your sight. We call it the silent thief of vision. There are no symptoms. You don't feel redness, you don't feel pain, and it's slowly robbing you of your sight. The only way to detect glaucoma is with a comprehensive dilated eye exam by an optometrist and or ophthalmologist. And so it's important that if you have a family member that has glaucoma, or if you have certain diseases that put you at risk, such as diabetes for glaucoma, or taking medications such as steroid that can cause glaucoma, that you get checked, and so early detection is possible so that we can preserve your sight. You can have high blood pressure, you know, the silent killer, and a lot of patients are walking around asymptomatic with a high blood pressure. But one of the ways that we can detect that patients have high blood pressure, because 160 million Americans have high blood pressure. A lot of people don't even know that they have it. And so one way that we can detect is through an eye exam. And an eye exam is not only checking your vision, making sure that you either get glasses or you're talked to about dry eyes, but checking the eye health, as Dr. Olivares said, looking at the retinal health. We can see changes in the back of the eyes from high blood pressure and cholesterol and many other diseases. Any disease that you have, whether it's rheumatoid arthritis, whether it's high blood pressure, it can impact the eye. So I want the audience to understand that, your eyes sometimes are the initial manifestation of underlying systemic problems. We always say that the eyes are the window into the soul. Well, the eyes are the window into detecting diseases. And a lot of times, like, patients are walking around not knowing they have diabetes, not knowing that they have high blood pressure. And one way that we can detect that is through a comprehensive dilated eye exam. So anyone that has any sort of underlying condition, you need to get an eye exam. And or most importantly, the takeaway from this is every year, everyone should get a comprehensive dilated eye exam.
Yeah, go
Yeah.
ahead, Dr.
Go ahead.
Blanc.
Go ahead.
No, you go ahead. I've been talking too much.
No. You're never talking too much. You can go ahead, ladies first, and then I'll go ahead.
Okay, I'll be quick.
Yeah.
As Dr. Reynolds had mentioned, having, a family history of certain diseases. I think a lot of times we don't realize that some family members have glaucoma. When we are, talking during dinner or family reunions, we don't really talk about our medical or eye health. So it's really important that, you ask your family, are there any diseases that run, in our family as far as eyes go or health goes, because that might put you at higher risk for developing them in the future. And it's really important to know those things.
Yes. And also what I would like to piggyback on. So the question was, is there like common symptoms that you can have that would detect that something's going on, right? For example. So the answer is yes and no, right? And let me give you a quick example I had with a patient of mine that I had a few years back. Okay, the patient came in one time, and the first question we optometrists usually ask is, "What brings you in today for an eye exam?" And the patient said, "I don't know. My wife brought me in." Right? Like, fair enough. Okay, so we started the examination, and everything was doing okay until we started going through the visual acuities. Is when we check one eye at a time, and we ask them, what can they see? Can they see this line? Can they see this line? Right. So the first eye, we covered the left eye. The right eye seen pretty well, 20/20. We get to the left eye, nothing. Hand motion, can't see anything. You just waving the hands. He had not noticed that because his dominant eye was picking up for the non-dominant eye, which was the bad eye. So that was precarious. So when we did the refraction, which is the better 1 or 2, it yielded no results. Nothing was coming up. Could not see anything. Nothing was making it better. So when it came to the dilated fundus examination to check the health of the eyes, inside of the eyes looked well. Everything looked well. So it's immediately I was like, okay, there's something behind the eye that's causing the problem. It's not ocularly related. It's got to be in the brain. Send him out to Aventura Hospital to get a brain scan. And he ended up having a large frontal tumor and a large frontal tumor. So sometimes a tumor give you headaches. Sometimes it does not. In his case, it did not give him any headaches. The way we was able to catch it was through a comprehensive eye exam.
Thank you, Dr. Blanc. That is so interesting that you brought that up, because I was remiss in not mentioning that. I always say an eye exam is more than saving sight. We as eye doctors, we save lives. And a lot of times patients can have neurological component. They can have a brain cancer, a brain lesion, a brain tumor, brain inflammation that can present with ocular manifestations such as the loss of vision that Dr. Blanc says. For us, we work with neurologists. We have patients that have acute onset to and seeing 2 images. So you may have symptoms where you may have fluctuating vision. Patients that have diabetes, if their sugar is not well controlled, they can have change in vision. Some days, this month they see clear, next month their sugar is a little high, might see blurry. So any blurry vision that a patient might have, they need to see an eye doctor. The patient sees 2, like 2 images or 2 of me on the screen, and they never saw 2 before, it can be an indication that the patient has something going on the brain. And as Dr. Olivares said, you can have a patient that has eye cancer within the eye and not have any symptoms whatsoever. So I think really this is just highlighting and underscoring to the audience that we as eye doctors are an important part. Optometrists are an important part. And I want to thank Dr. Osgood for supporting us here in Florida, making sure that we have our doctor's title, because again, we just don't save sight, we save lives.
And I'm going to jump in. We have a Facebook audience, and Miss Finch is on Facebook, and she's discussing how she's beginning to have difficulty seeing at night. She says she recently had an exam, and they told her she had a small amount of cataract in her right eye, but now she's finding that driving at night is not good for her. Is it something that happens in the eye when night comes and you can't see as good as you can see in the daytime?
Yes. Let me give you a quick and dirty example, right? When you buy a brand new car, if you look at the headlights, right? The headlights, when the visibility out of the headlights is clear, nice and clear, right? So you're driving, you're taking the corner, you're able to see nice and clear. 10 years later, that car developed cataracts, right? So now the light is not as bright. So it's similar, right? So as time go on, you develop cataracts. So the lights that's coming in is not as bright. So it seems dim.
Go ahead, Dr. Reynolds.
Yeah, I was just going to mention the audience member or the person from Facebook has cataracts, but cataracts is one of those eye conditions that can rob you of your sight. Cataracts is the leading cause of vision loss worldwide. In the United States, we have ways to treat our patients early. So some of the symptomology for the patient or some of the symptoms, like you said, that she has night vision issues is when you're driving at night, a part of your eye is a little bit wider open. Your pupil's a little bit more wide open. During the day, it's more constricted, so things appear much clearer. So at night, for our patients that have cataracts, anyone that has cataracts, they will always have night vision issue because that lens is causing a blur. But what I just want to underscore and leave is if anyone's taking medications like steroid, or again, if you have diabetes, you're 60% more likely to develop cataracts sooner and earlier. So that's why it's important. You're always going to hear me say this all the time you call my name, that we get a comprehensive dilated eye exam. I can't stress it enough, by an optometrist, so that we can detect the cataracts and so that we can get you to be referred an appropriate time to have the surgery if you need the surgery.
And there are different levels and types of cataracts. So some progress a little bit quicker than others. So I do have some patients that even 4-6 months after their eye exam, they notice a big decline in their vision. So if that's the case, I recommend going back to be checked again and evaluated again for those cataracts, because it may be time to remove them.
So I'm going to rewind because you guys spoke about it, and I think we're all guilty. We're all glued to our cell phones. A lot of older people are on Facebook. If you're like me, a millennial born in the wrong generation, you're on Facebook, Twitter, Instagram. Things are changing now. They have some new social media, but you see a lot of kids with phones. It's like it's their new babysitter, and they're just glued to those phones. So when you take a child in for just a routine exam, it's not something that they're required to do the eye exam per se. So can you talk again in depth about the importance of that and what happens? You kind of mentioned that it messes up your sleep with the blue rays, but go in depth, tell us more. Because I think a lot of times we can't sleep at night, and it's just because we've been strolling through TikTok for 30 minutes and now we can't sleep and we think it's something else. So could you guys go more into that for us, please?
We certainly can. I think Dr. Olivares did a great job, so I may have her segue in as well. But I just want to reiterate with our younger, our children, that we're seeing a lot more individuals, not just children, but younger adults and older adults on computers. One of the things that we touched on earlier was the the damage of the blue light. So I think someone asked about blue filters on their glasses. Some doctors are doing that, but just being on those devices can cause eye health issues. So it's important that we take frequent breaks, that we're not on them as much, and that we get a comprehensive eye exam. For our children, Dr. Olivares, you did a great job in talking to the parents. Again, screening when they go to the pediatrician is important, but children can be 20/20, see very good. Sometimes they don't even know how to articulate to their parents if they're having any issues. Sometimes the teachers might notice that they're holding things too close, or the child might come home from school with a headache. Those that kind of symptoms can indicate a visual issue because they're having issue focusing on the target that's up close, or bringing their eyes in, focusing. So that might indicate that they may need glasses to help with their focusing issues. And Dr. Olivares, you gave some other great examples, so I'll segue to you.
So it has been shown that being outdoors really helps exercise the vision so that our children don't develop nearsightedness. So, you know, obviously, if parents are nearsighted, they have a much higher risk of becoming nearsighted as the child. But the best thing to do is enroll them in sports, let them play outside, playgrounds. That's what's really going to help protect their eyes from developing nearsightedness. We know that being nearsighted is an actual elongation or growth of the eye that can happen in children that's at an abnormal rate. Now, if you get your child checked early, we can see if the level of myopia or farsightedness that they have is normal for their age. So a child between the age of about, newborn to about 6 should be a little bit farsighted, not nearsighted. So we know if we see a 4-year-old that is nearsighted, that's going to be a big problem for them as they go on through life, because your vision doesn't really start to stabilize until you're about 18 years of age. So if there is a 2-year-old that is about a -2 prescription, they could end up a -10, for all we know, by the time that they're 18. So there are ways of slowing down the progression of nearsightedness that we didn't have when we were younger. There are 3 main ways of doing that. And each plan is catered to that child in order to help them so that they don't develop these issues with their vision, such as mentioned before, the retinal detachments, cataracts, and glaucoma, which we know are all things that can happen as the myopia or the amount of prescription gets higher.
So it's interesting. It's interesting to note as well that the more education that a country or a civilization tend to have, the more myopia, which is nearsightedness, that civilization tend to have. For example, like I do a lot of medical mission trips. And so when I go to these third world countries, they tend to have less myopia, nearsightedness, than let's say kids in the United States. And that's because the kids in the United States have more access to tablets and phones and computers, as opposed to the ones at a third world country.
And the most is Asia. They have the most amount of myopia, so a lot of kids there are wearing glasses. But the advancements for myopia has come a long way, that there are a lot of promising treatments that we can offer these children if their patients come to us, if their parents bring the child to us early for an eye exam. Earlier detection is better.
Oh,
I was just going to mention, Senator Osgood, I think for anyone that
ahead.
asks that question, I think it's important, the screen time, being on these devices, computer work, computer fatigue, there's so much that that can impact your overall health and your eye health. So if you're on these devices, if you're doing a lot of these, you're working from home, it's important to get an eye exam and talk to your eye doctor about some of the issues that is occurring. A lot of times we're not blinking properly, we're staring at the screen, so we tend to have drier eyes than normal for some patients, especially older adults. If they're watching their family members on Facebook, watching videos, they may not be blinking properly, and so they may have eye issues, or their eyes might be tearing a bit or feel sandy and gritty because you're staring at the screen, you're not blinking. And again, the blue light that's emitted from these screen devices can be damaging. And then finally, as Dr. Olivares said, I just want to stress for children, because we're seeing a lot more children not only develop nearsightedness or the inability to see far, and the term is myopia. And the problem is myopia causes a lot of problem. It's causing vision loss because it's that pull of the eye, and it's causing some people that develop, we call it pathological myopia, but it's the myopia that causes vision loss because the prescription is too much. So the key message is to make sure that children, school-age children, are getting yearly comprehensive dilated eye exam, as well as our young adults, those individuals in colleges. There's something called college myopia. As soon as they go off to school, because they're studying more, they're doing more, they probably need glasses when they're in college. They should be getting a yearly eye exam as well. And then for all adults, even our older adults, every year, get your eyes checked by an optometrist.
So that being said, right, Dr. Reynolds, access to eye care is important, correct? Right. There are 3,300 active licensed Florida optometrists, and there's only 620 ophthalmologist licenses in Florida, right? So you can see we optometrists outnumbers ophthalmologists by 5 times, right? So access to eye care and to the clinics and to the facilities to be able to get these things checked is very important.
I'm going to ask if any of our audience have any questions. If you could raise your hand, if you have questions for our doctors, we want to make sure we answer those questions. I'm strolling through Facebook. We had that one question. Any of the viewers that's on the Zoom have any questions at this time? Yes, ma'am, Miss Cassandra.
Good evening, everyone. And Dr. Blanc, I just wanted you, because some people may not know the difference between an optometrist and an ophthalmologist, so you might want to just explain that.
Okay, thank you. So in optometrists, you get the quick and easy way to think about it is the optometrist is like the primary care physician of the eye, right? And then when we notice something, we'll send them out to ophthalmologists. But at least here in the state of Florida, there's some states that the optometrist can do advanced procedures like slight surgical removal of lumps and bumps, and some laser procedures. And actually at Nova Southeastern University in our own backyard here in Davie, they actually train the students to do these lumps and bumps and removals and laser. Just to keep them at the highest level, so that if they go to these one of these states that have the ability to perform these procedures, they can. Ophthalmologists, most of them, they have different type of ophthalmologists, like your cataract specialist, your retinal specialist, your neuro ophthalmologist, and it depends on what they do. But for the most part, ophthalmologists usually graduate medical school or osteopathic medicine medical school, and they would do the main surgery, if you would. So the specialist. So we do the primary care procedures, and then send them out to the specialist if need be. We also optometrists are the only one that works with specialty contact lenses as well. So there's some conditions in the eyes like keratoconus that can only be treated with specialty contact lenses that we deal with as well.
And as far as schooling goes, optometrists go to 4 years of optometry school after graduating from a 4-year college. And then you can go on to residency. So like Dr. Blanc went to residency for contact lenses. And then ophthalmologists, like he had stated, do the 4 years of medical school and then do a residency after. Optometrists, those 4 years of optometry school, all we do is focus on the eyes. We first learn about the whole body and how it connects to the eyes and how it relates to the eyes. But those 4 years, we are constantly focusing on those eyes. Ophthalmologists, because they get their medical degree, learn about the whole body, and then they go on to learn about the eyes during their residency training.
Thank you for sharing. I wanted to ask another question that Julie, I know she's still having issues with her connection, but she asked, what do freckles in the eye mean? Because she has a freckle in one of her eyes, and I know that it can, I've heard it, known other people that have it. What is, could you talk to us about that?
Well, that depends. You can have a freckle in the front of the eye, just like you have a mole on the body. So when you have a mole on your body, it can be a sign of a skin cancer, right? So we say it's a mole, we say it's a freckle or a spot or a lesion on the body. The interesting thing is you can watch that. Your primary care physician can watch that. If that mole changes in size, shape, color, you are suspicious for skin cancer. And so you will get that lesion biopsy to make sure you don't have a skin cancer. In the eyes, when we see pigmented spots, doctors might use the term freckle to describe that pigmented spot. That pigmented spot can be on the color part of your eye, can be in the back of your eye on the retina. As Dr. Olivares said, the patient was 20/20 that came into her, but had a melanoma in the back of the eyes. So the optometrist, if it's a spot and it's not large, it doesn't have certain clinical features, could be described as a freckle in the back of the eye. What's important for that patient is that optometrist, that eye care practitioner takes a retinal picture of that freckle spot, and that patient is evaluated every year to make sure that spot doesn't change in size, shape, or color. Because if there is a change in size, shape, or color, it will indicate that that patient's freckle spot has now become a melanoma. So just like you have a skin melanoma, which can cause other problems, patients that have melanoma, and can die, can metastasize to the brain, it can cause issues, right? So we know skin cancer, it needs to be detected early and treated early to preserve the patient's life. Same thing in the back of the eye. If they have an eye cancer or they have that choroidal melanoma, as Dr. Olivares said, we'll send it to the specialist. That specialist will treat it with whether radiation or chemotherapy for the patient. So that's what that freckle spot terminology comes from, in the back of the eyes. And so whoever that person is, your friend, whoever that person that asked that question, that person needs to be evaluated every year to make sure that freckle spot doesn't change in size, shape, or color. And it's important to be evaluated every year because those freckle spots can remain the same for years. And then that 1 year, I had a patient who was following for 12 years. On the 13th year, it grew and it was now an eye cancer and he needed to be treated. So any spots in the eyes need to be documented, photographed, and followed very closely by your eye care practitioner.
So I'm going
Thank
to
you.
ask the bombshell question that I thought somebody would have asked now, and I'm taking off my glasses. So
I see the
talk to
lashes.
us about these eyelashes.
We had mentioned about those eyelashes. I see those eyelashes. First, I want to comment. Thank you so much for speaking at the National Optometric Association, Senator Osgood. It was really a pleasure to have you as past president. And thank you so much for supporting optometry. We are eye doctors. We care about our patients. We graduate with a Doctor of Optometry degree. The eyelash I mentioned earlier, they look beautiful. They're amazing. They're awesome. Some people spend a lot of money on those eyelashes, but sometimes the glue that people use, especially at home to put those eyelashes on, can get into the eye and be an irritant. It can cause problems on the cornea. It can cause red, irritated eyes. If that happens, you need to see an eye doctor as soon as possible. The second thing that can happen with those eyelashes is that people don't really clean them very good. I know people who've had eyelashes. I've seen patients, you know, Dr. Olivares, I had someone who had eyelashes on for 6 months. I don't know how you can have the eyelashes on for 6 months, and it can cause a bacterial infection or bacterial growth around the eyelid. So it's important that you want to change those, you know, properly. I don't know how long they last. I don't wear the lashes myself, but the other thing that those eyelashes do is sometimes the glue, Senator Osgood, you pull out your own lashes. So you tend to lose your lashes because of eyelash use. And I'll let Dr. Olivares mention some more things that can cause problems. They're beautiful, but they can cause problems.
Yeah, so I've had numerous patients that have had an allergic reaction to the glue. So they come back to me after insertion of the eyelashes, and their eyes are literally shut and swollen. So those patients obviously have to get the eyelashes removed a special way, because with false extensions that you get put in one at a time by a specialist, you can't just take them off yourself. There is a special type of remover that is very strong, and if getting into the eye, it could be very hazardous. Also, like Dr. Reynolds had mentioned, you can get what's called Demodex, or these mites that live in your eyelashes that can actually cause issues with styes or any type of infection, conjunctivitis, red eyes, irritated eyes. So I know that you get these lashes put on, you don't really want to touch them, you don't like to move when you sleep like this, not on your face, to not ruin them. But it's so important to keep them nice and clean, because when we see them underneath the microscope, it is nasty. You know, I say to my patients, you know, I know you look great, you look beautiful, but I'm sure you'd look beautiful without those lashes too, because man, are they causing some bacteria to form along your eyelids and your eyelashes. You know, I personally tried it myself once, because after I was giving birth to my first born, and I was like, I want to look beautiful during, you know, birth. I knew I couldn't put on makeup. And I can tell you that after that, over the next few weeks, I lost all of my eyelashes. I really looked extremely strange, because all my eyelashes fell off as the false eyelashes were coming off as well. Now, we naturally lose eyelashes every day, but the eyelashes, our natural eyelashes, are not meant to hold on more hair, because it can weigh them down and you can damage your natural eyelash. And, you know, part of the eyelash's function is to catch bacteria and dust from the air. It's supposed to protect our eyes. So if we're damaging our own eyelashes, that could become a problem.
And there's two other things that I noticed and practiced with these eyelashes. First of all, I'm not a huge fan of them, but there's two other things, right? One, dry eyes, because what they do is the glue will cover the glands, that it's very useful for secretions for the dry eyes, right? So people will complain of having dry eyes a lot, and it's because they're covering the glands with the glue. And another thing is some of them, you know, apparently there are different degrees of different lengths of eyelashes. So the longer the eyelash, right, the more it weighs down, and it starts to obscure your peripheral vision, right? So now when you're trying to change lane, you're more likely to sideswipe a car, because you can't really see, because your eyelashes is obscuring your peripheral vision.
So Senator Osgood, what we're saying, you can wear the lashes. The lashes look amazing and beautiful. We just want patients to, or the audience to understand, if you have any sort of red, irritated eyes, it could be the glue. You got to be very careful with the glue. You want to get your eyes checked. If you have those long lashes, as Dr. Blanc said, that's a problem. Some people have these really long lashes, and it can pull, it's too much of a weight on your eyelid. So anyone who has false lashes need to make sure that they get a comprehensive dilated eye exam. That's my theme for tonight. Really comprehensive dilated eye exam. So you should get your eyes checked, Senator. Come see us at Nova Southeastern University College of Optometry, and we'll check those eyes of yours.
Thank you, guys. So I really appreciate the wonderful discussion. We know what to do with our lashes now. We know we got to take the kids in, and every year we're going to be there at your office. Before we close for the evening, I'd love to give the chance to each of you kind of close out with any final comments, anything that you want to say to the audience before we head out. Dr. Blanc, you want to go first?
Yes. In closing, like Dr. Reynolds said, probably 100 times, like Dr. Reynolds, you have to have your yearly eye exams. A lot of the time, like Dr. Reynolds said before, a lot of time people think because they see good, their vision, everything is good, and that's just not the case, right? Because you see good. Remember when I was telling you about the macula? When you're looking at someone, you're mostly using your macula, where you can have a whole bunch of problems going on outside of the macula, and you're not noticing yet until it gets into the macula. And when it gets to that point, sometimes it's a little bit too late to help the person, because now your best corrective visual acuity may not be 20/20 anymore. You might be worse than 20/20. And sometimes, depending on your occupation, right, you can't get the occupation, you can't be in your occupation if your vision is not a certain level, right? You can't even drive if your visual acuity is at not a certain level in Florida. So definitely get your yearly eye exam. And if you're diabetic, you might need to get it twice a year.
Thank you. Dr. Richards?
It's Dr. Reynolds, but
Dr. Reynolds, sorry.
Yeah, that's okay. It's okay. So in conclusion, or concluding, I just want to again stress the importance. I say this all the time, and anytime I do any sort of lectures, anytime I talk for anyone, that eye health, like I said, it's so important. We not only just save sight as eye doctors, we can potentially save your life. And it's important to get a comprehensive eye exam. Do you know what the #1 most feared loss is for individuals? Their vision. People would rather lose, a toe. They would rather lose, have a paralysis of their one hand. But losing your vision is such a feared loss. And so I always stress the importance of a comprehensive eye exam every year, because a lot of times we have eye conditions. Like I said earlier, you can see 20/20. You can have no symptoms, but when you have glaucoma and you have advanced disease, it's robbing you of your sight. So in order to prevent loss of vision, it's so critically important to detect the disease early, to treat the disease early so that we can preserve your sight and potentially save your lives. An eye exam can predict stroke. An eye exam can, again, indicate that there's an underlying systemic disease. An eye exam can indicate that there's a brain tumor, an eye tumor. So again, it's so critically important, as I've said throughout this webinar, that every year you should get your eyes examined by an optometrist or an ophthalmologist to make sure you don't have any eye problems. And last but not least, it's important to get our children an eye exam every year as well. They can see perfectly, but have visual issues that can impact their success in learning. So an eye exam every year is my conclusion. Thank you.
Thank you.
So for me, many vision problems go unrecognized for many years, and that goes with adults and kids. But like I had stated before, 1 in 4 school-age children require some sort of vision treatment. A lot of times they don't know how to complain about their vision or let you know that they're seeing poorly or having problems. So the things that parents can look for are sudden loss of interest in reading or their homework, losing their place or poor comprehension after reading, tilting their head or closing one eye while reading. Those are the type of things that we as parents can look for. And also, it's never too early to get them checked. A lot of parents feel like they have to wait until their child can speak or say their letters or tell us which is better, 1 or 2. But in reality, we as optometrists, we have ways of checking children's vision without any of their responses. It's all going to be objective testing, no subjective testing. So I would like to end with saying, get your kids' visions checked. Super important.
Thank you. So tell us how someone can make an appointment to come get that comprehensive eye exam. Where can they go to find you guys to get that, whether it's adult or a child?
Well, for me here in South Florida, Nova Southeastern University College of Optometry, it's located in Davie, Florida. Dr. Olivares and Dr. Blanc were my students. I know I look 25, but they were my students. And so you can contact the Eye Care Institute for a comprehensive eye exam, but it's not just here in South Florida, Nova Southeastern University. I would recommend throughout the state of Florida, right? And even nationwide, you can contact an eye doctor. We have great, amazing eye doctors at various facilities. I would not even, my colleagues that practice at America's Best are awesome eye doctors as well. So just contact your local nearest eye doctor for a yearly comprehensive eye exam and establishing a relationship with an eye doctor, because you're going to be seeing them every year. They're like your, as Dr. Blanc said, your primary care physician. You're going to see them every year for your eye wellness check. Make sure that everything is good, and that it's not just glasses or contacts that you're going to get, but you're going to get a comprehensive evaluation. And sometimes some eye doctors will take retinal photography or take pictures of the back of your eyes to show you what's going on in the back of your eyes. So contact your local eye doctor, whether again it's at an America's Best, it's at Nova Southeast University's private practice, and get your eyes examined every year.
Thank you. And thank you all for joining us this afternoon. And thank you to Julie, Ruby, and Nigel for putting this together. And we ask that you continue to stay tuned for Tuesday Talks. We try to do Tuesday Talks every Tuesday. We're going to modify it a little bit and maybe go to once or twice a month. But we want to continue to discuss these types of topics and share information with the community. And again, thank all of you for giving us your time. I love Nova Southeastern University as a graduate myself. And feel free to reach out to our office for us to share any information that you want to get out, anything that you're doing. And Dr. Blanc, I would love to accompany you on some of those mission trips. I love visiting other countries and helping there. But thank you again to the Senate District 32 staff and to all of you for joining us tonight for another Tuesday Talk. Good night.
Thank you, Senator Osgood.
Thank you
Thank
so
you.
much.
Thank you. Good night.